I had Restylane injected under my eyes. Do I need to wait for eye bag surgery? If so, how long? Recently got Botox on forehead area and side of eyes in April, and Restylane under my eyes on May 17 to see if it could help with not looking tired. Although the results are very noticeable and there is improvement, I feel I may need eye bag surgery.
Thank you for your question. You've submitted several photos with your question. You stated in your question that you had some Restylane placed under your eyes with a desire to look less tired, and you are aware that you still need lower eyelid surgery. So you're asking, what's the time frame do you have to wait before having the surgery? Well, I can certainly help you understand understand my strategy when I deal with patients like yourself in my practice, which I do a fair amount. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and under-eye bag surgery has been the foundation in many ways of the practice, and it's a procedure we essentially do every day, and we help patients who come to us from around the world with this issue as well as many other more complicated issues. So to understand the philosophy, you have to understand a little bit about the anatomy and the placement of these fillers. When fillers became introduced as a way to help people look better who have under-eye bags, it became clear to me, and it actually ultimately proved to be true, that a lot of people with very prominent under-eye bags were going to get fillers but still not be satisfied with the full correction in terms of the outcome. Essentially, with the under-eye puffiness, if someone has a mild amount, a minimal amount, you can get a very nice result to camouflage the under-eye area with fillers. But once it's beyond a certain amount, you can actually slightly improve, or you can actually make it look worse. So when patients like yourself come to my practice, I first guide them as to what's the explanation for the under-eye bags. So the under-eye bags are referred to technically as lower eyelid fat prolapse. This means that the fat that's around the eyes pushes forward and creates this bulge. And it's mostly a genetic issue, can be aggravated certainly, or can become more advanced with smoking, allergies, sinuses, as well as just normal facial aging. The approach that I typically do for someone like yourself is I do a procedure called a transconjunctival blepharoplasty. This means addressing those fat pockets from the inside the eyelid, and this way avoiding an external incision and going directly to the fat pockets and doing what's appropriate to sculpt them in a way so that it looks as if you never had the under-eye bags. So then the question arises, how do we differentiate the volume that's from the filler from the volume that's in the fat? Well, from the fat. I would say that in physical examination, when we have a patient look up and look in different directions, we can see the fat volume actually push forward. Now, if there is filler that is maybe obscuring the full clarity of this, I usually don't actually wait for the filler to go away. I can actually dissolve the filler with hyaluronidase, which is an enzyme that dissolves the filler. Now, that doesn't necessarily mean that there's no role for filler in the future. It's a very important caveat. The reason is that when we think about facial aging and cosmetic procedures, often when the under-eye bag is the dominant issue, then patients always focus only on that under-eye bag. But what I'll bring to their attention is that concurrently they can have issues with volume loss in the cheek area. They can have volume loss directly below the orbital rim as well as in the tear trough area. And so I explained that after we take away the big negative of the under-eye bags, you may still need fillers. So it's not like we have just one procedure to solve everything for the rest of your life, but rather to understand that there is a strategy of addressing what is the dominant issue, and in your case, the under eye bag. So to summarize, essentially after physical examination, if I would not be able to tell or at least help you see what your before and after would be, because you can't really tell what's fat and and where does the fat begin and where does the Restylane begin and end and where the transitions are, then it's very straightforward to just dissolve the material. And I've done that for many patients because a lot of times they've come in with under eye bags, and when they got filler, they ended up looking even more puffy. And so I have had patients where we had to do a couple of rounds of hyaluronidase before we actually saw their true anatomy. I'm not saying that's the case for you, but I think that you don't have to necessarily wait if you'd like to address this sooner rather than later. Now, as far as if you wanted to choose to wait, I think it's fairly well understood, at least from my experience, that the time frame for Restylane to be metabolized in the under eye area really varies. It can be as little as a few months to as long as several years. So I think that since if you're looking for a more definitive procedure, have the consultation with a specialist, someone like an oculofacial plastic and reconstructive surgeon, someone who understands the eyelids very well, who understands how to do the transconjunctival approach, and is able to help you to understand the difference between the under eye bags and the Restylane. And then you make an informed decision. You can wait, or you can move forward and have the material dissolved, or do it without having the material dissolved. That's also an option. Sometimes people feel that a filler that they had like 2 years ago may still be present, but when I examine them, I see no evidence, and so I tell them there's no filler, we can go ahead and proceed, and from that point we go forward with the surgery. Now, I think that based on that, again, move forward with meeting with qualified, experienced doctors who perform these types of procedures, cosmetic surgeons, oculofacial, plastic, reconstructive surgeons, and hopefully you'll be able to achieve a nicer aesthetic appearance for your eyes. So I hope that was helpful. I wish you the best of luck, and thank you for your question.